Let's, if you don't mind, talk about the five most common Medicare questions that you get.
Well, I'm going to walk you through the top 5 Medicare questions that I get asked most often with the people that I meet with on a day-to-day basis. Now, this is, no particular order. It's just, the top 5 questions that we get. And then I'm also going to do another video showing some of the top 5 questions that are not asked that should be. But question number 1, when should I enroll in Medicare? Well, this is probably the most common question I get. And, one of the things I've always said on all of the shows I've ever done is it depends. And I know that that's not a good answer, but it does really depend on a couple of scenarios and situations that you may be coming into. Most people are eligible for Medicare at age 65. So you have enrollment periods. You have what's called your initial enrollment period, and this is the first time you can enroll in Medicare. And that is typically the time when you are first turning 65. You've got 3 months prior, the month of, and 3 months after your 65th birth month to actually enroll in Medicare. Now, the other thing is if you are working, you actually can choose to put off enrolling in Medicare. That actually is a lot of different scenarios, which we're going to talk about in another video that I'm going to put out there also. If you are collecting Social Security, you will automatically be enrolled in Medicare. You won't have to do anything. It just automatically happens. So if you're enrolled in Social Security, you'll get Medicare automatically. If you're not taking Social Security, then you have to be proactive and actually do the application and enroll in Medicare yourself. This is where I can actually help you. You can come into the office, you can schedule on our website, or give us a phone call to schedule an appointment. We can sit down and go through the actual enrollment process for you. I do have a video that out on the website. It's americasmedicareassociates.com. And on that site, I've got a video specifically geared towards enrollment periods and how to actually enroll. The next question that we get is, what is the differences between Part A, Part B, Part C, and Part D? Well, this is another very, very common question. I'm going to briefly hit this for you and move on to the next question. But this question is very simply this. Part A is hospitalization. It's as simple as that. It covers hospital stays. If you're in the hospital, go from the hospital to a skilled nursing facility. This is where coverage A for hospitalization comes into play. It does also cover some blood work that is done through the hospital. So Part A is hospitalization. Part B is going to be your medical services. This is going to be your durable medical equipment, your physician fees, your MRIs, your CTs, your X-rays. This is all of the physician fees. So Part A, hospital, Part B, medical. Now I'm going to jump to Part D. I'm going to skip C, and I'm going to jump to Part D. Part D is actually the prescription drug portion of Medicare. You have to purchase a drug card once you're initially eligible, and that is covered under Part D for the prescription drugs. And then we go back to Part C. Part C is actually what is referred to as the Advantage plans. I'm sure all of you are very familiar with what an actual Advantage plan is. If not, we can help you understand better what those are. But the Part C Advantage plans actually cover Part A, Part B, and Part D all in one plan. The next question I get quite frequently is, can I delay Medicare if I'm still working? Once again, I know I keep referring to this, but there is a video out on our website that actually discusses in detail whether or not you should or shouldn't take Medicare if you are actually working. So here's the big question with that. If you're still working and you have employer-sponsored health coverage, either yourself or on your spouse's plan, you are turning 65, you do not have to sign up for Medicare. You don't have to sign up for Part A, Part B, Part D, anything if you've got employer-sponsored coverage. Now, the caveat to that is this. If you work for an employer with 20 or more employees, then you do not have to sign up. Your employer plan would be primary, Medicare would be secondary. If you work for an employer with less than 20 employees, then I would highly advise and encourage you to sign up for Medicare to avoid any late enrollment penalties. So you don't necessarily have to sign up for Medicare if you are on an employer plan. It really comes down to dollars and cents and benefits and coverages. I encourage you to check out our other video that gets into more detail about that. Another question we have is, what does Medicare not cover? This is a big one because a lot of people aren't really familiar with all of the coverages that are not included in Medicare. For example, dental, vision, and hearing are not part of the original Medicare coverage. If you want these coverages, then you have to be proactive and actually sign up for these independent individual benefits and coverages. Yes, there is a premium that comes along with that. They do have premiums attached to them. Long-term care. This is probably the most overlooked benefit out there. And we cover long-term care on a separate policy, separate plan for you. But Medicare does not cover long-term care. Please don't confuse this with skilled nursing. Skilled nursing coverage is covered under the Medicare, but long-term care past 101 days, there is no coverage on Medicare for long-term care that you might need. Overseas travel is kind of sketchy. Some plans do cover, but Medicare, original Medicare, is very, very limited on what coverages and benefits they offer. You're going to have a $250 benefit for overseas coverage. Routine foot care. Here's another one that's not covered. Routine foot care is not covered by original Medicare. Now, it is covered under some of the plans you can purchase to cover what Medicare doesn't cover, but original Medicare does not cover that. Moving on to the last question, will I pay a penalty if I don't enroll on time? The easy answer to that question is yes. You will be penalized. And the unfortunate thing with the penalty is you will be penalized for life if you do not sign up for Medicare during your initial enrollment period and if you do not have credible coverage. So let's say if you do not have an employer-sponsored plan or your wife does not have an employer-sponsored plan and you choose to not sign up for Medicare, you will be penalized. The Part B premium, you'll get a penalty for that. It's 10% for every 12 months you did not sign up that you should have. Yes, that goes up to 100%. So right now for 2025, the Medicare premium is $185. If you did not sign up for Medicare for the last 2 years, it's 20%, which is roughly $37. That goes on top of the $185 that you would have to pay for. So that follows you the rest of your life. The other penalty comes into play is for prescription drugs. If you do not sign up for a drug card, then you will be penalized. That formula is 1% of the national average times every 12 months that you did not sign up for a prescription drug card, and that could be extremely costly to you. So those are the top 5 questions that I run into on a day-to-day basis, meeting with all of the new Medicare recipients. I encourage you to check out all of our other videos we have out there on our website. And if you have any questions, if you're nearing 65, either currently enrolled or looking to enroll or review your current plan, please reach out to us. We're more than happy to help you. We can go through each individual scenario and figure out what's going to be the best options for you moving through your Medicare and retirement.